I think that the idea of deaths and despairs really shows how communities feel the weight of addiction unfairly, and I believe that gender plays a big role in the imbalance. I understand that men are usually more present in overdose statistics, but I feel like women carry a different burden that isn't always visible. I think a lot of the time women end up withstanding emotional labor when someone is in their house is struggling with opioid usage. I feel like this means that they're having to juggle childcare, household needs, and the emotional fallout of family while also navigating through their fear, instability, and grief. I feel like this reinforces gender expectations, putting even more pressure on women during already devastating circumstances. I think the broader idea is that society can't address addiction without also addressing gender expectations around care responsibility and emotional work. The article by Peters et al. Talks about how death of despair are linked to substance abuse, suicide, and economic hardship. This shows how the opioid crisis is connected to life struggles like unemployment and mental health. It also shows how it affects men a lot because they're most likely to die from deaths in despair. The article also talks about how women often take on caregiving roles in families affected by addiction. This relates to gender expectations because women are usually the ones left to handle daily responsibilities like taking care of kids and family members when someone is struggling with opioid use. Growing up, my mom struggled with addiction. I saw how women end up carrying the emotional weight that nobody else can see. I remember watching her try to hold herself together while she was trying to take care of me and my sisters, even when she was hurting inside. I felt the pressure fall on me and my sisters too, especially when our mom was falling into her addiction. The emotional labor always seemed hard on my mom, especially when she knew she was addicted but still had to be there and provide for us. Living in the environment with my mom made me understand how addiction affects genders differently, not just in numbers but in responsibility. It changed how I view life and who ends up being there when everything around you is falling apart. I think the author makes it obvious that people most at risk are working class people. I understand this group faces both economic and social pressures that can make addiction more likely. I believe the indications that stand out are unstable employment, financial strain, and limited access to medical care. These struggles create conditions where opioid usage control can take control more easily. I feel like when all of these factors are combined, they leave people with less resources and options to cope. I think that acknowledging this can give us a real opportunity to intervene earlier when we can strengthen healthcare services, improve economic stability, and expand treatment options. I believe that putting time into these areas can reduce the vulnerability that can lead addiction into dark places. Addressing the root of these issues is just as important as addressing the addiction itself. The article by McGranahan and Parker talks about how rural populations like working class white individuals face the highest risk of opioid addiction. This shows the main groups that's mostly affected by opioid addiction. This is important because it shows that the epidemic is not evenly spread and it hits specific communities harder than the rest. They also talk about the key indications of causing opioid addictions are unemployment, poverty, and limited access to healthcare. This helps explain why the group is at risk. If people don't have jobs or healthcare, they're most likely to turn to opioids. Lastly, they talk about how expanding treatment access and economic opportunities can help reduce addiction rates. If we improve jobs in healthcare, we can lower the addiction. When I think about the group, when I think about what group is most, sorry, When I think about what group is most at risk for opioid addiction, I see my own family. I grew up around people who were dealing with unemployment, financial stress, and had no access to healthcare. I watched addiction take my family, not because they're bad people, but because our environment made it almost impossible for them to escape. I saw how poverty and a lack of support pushed my family towards drugs as a way to cope. Saying all of this is a part of what pushed me towards majoring in criminal justice. I want to understand the system that failed my family. I feel like my background gives me a deep understanding of why addiction grows in certain communities and how, when you're in that community, you feel like you can't do anything to prevent it. I think that after using poppies for pain relief, we've come to where we are today from when powerful medications were pushed onto people ignoring real risk. I understand that the aggressive promotion of these drugs created an irregular sense of safety and it led to more prescriptions than people could handle. I feel like this opened a door in overdose deaths. I feel like the companies involved have faced a lot of consequences like lawsuits and financial collapse because the people learn more about the role in the epidemic. I think that these outcomes showed the demand for accountability of those who contributed to the crisis. I believe the situation shows how dangerous it can be when profit is prioritized over people's health. In the article by Mike Davis, we hear about companies market opioid painkillers aggressively downplay their addictive potentials. Even though opioids existed for a long time, the misleading market made the addiction spread. They also say that the number of opioid killers prescriptions rocketed, and so did the case of opioid addictions. This shows the direct results how more prescriptions led to addictions. Purdue Pharma faced lawsuit and bankruptcy because of its role in the opioid crisis. I've seen how addiction can start in a way that doesn't look dangerous at first. My granddad overdosed on fentanyl, and I know his addiction didn't begin with that drug. His addiction began with medications that were supposed to help him but led to something deeper. With a lack of money, he heard about drugs that were cheaper but had the same effect. He started taking drugs that were laced with fentanyl and then started buying fentanyl straight. This is what killed my granddad. Watching my granddad die made me extremely nervous for my mom and her life. I've seen her through her highest highs and her lowest lows, and that showed me that it could be deadly. Some companies same seeing companies responsible for all these face consequences feels great, but it doesn't mean that the damage they cause can be undone. My family is living proof of how far the ripple effect can go. I think that Jan Rader's approach worked since she focused on sorry where focused on meeting people fast after an overdose and gave real support instead of judgment. Understand that the people she got helped reach out in a short period of time, and it made more people willing to accept help. I believe that the results can show how powerful the model can be, since a lot of people actually engaged with the treatment in the community and dropped in overdoses and deaths. I feel like this kind of system would work in other places where addiction is popular, especially in towns that struggle with limited resources. I think that everyday people contribute to giving by giving compassion, listening without judgment, and supporting efforts in their own community to work against addiction. I believe the small acts can make a big difference in someone who's trying to recover. Jane Radar talks about a quick response team that goes out and visits people within 72 hours. She created a team that follows up after overdoses instead of just responding one time. She says that up to 30 people have accepted some form of help. This shows that her program actually works and how people are getting treatment. She also talks about how the outcomes have shown huge reduction in overdoses and deaths. Lastly, she says, just by listening and being kind, you have the ability to make a difference. It shows how people can help by showing compassion and support. I think that this week's materials showed me how the epidemic came to be what it is and how men and women have different kinds of harm. I understand that men were most likely to become addicted and being prescribed pain medication since drugs started to change how their brain process pain. I believe women end up carrying the emotional impact weight of caring for the loved ones who struggled a different time of long-term impact. I feel like young people were also affected, especially because some switched from prescription drugs to cheaper but worse substances, which put an entire group of people at risk. I think the ripple effect works in crazy ways because it doesn't only affect the specific person, but it affects family, friends, and coworkers and communities, and they have to navigate through fear, instability, and grief. I believe that this shows how addiction never happens in isolation, how everyone around the person is pulled into the crisis somehow in some way. Addiction didn't just affect my mom, and it affected my entire life. I grew up watching her change based on who she was surrounded herself with, especially her friends. I saw my mom's addiction affected me emotionally, mentally, and physically, whether I was living with her or living with my dad. My life was shaped by her addiction and the addiction of others around us. I know what it feels like to lose someone to an overdose, and I also know what it's like to love someone who's still fighting against it. The whole scenario doesn't just impact people, it affected the story of my childhood, and pushed me towards a future where I want to help others through the criminal justice system.